Well, welcome to another week of The Sprout, where we are taking time to highlight all of the ways that Richland Community College is bringing redemption and innovation through education. I am super excited this week. I am sitting down with Dr. Tasha Jones to talk about the healthcare programs and education that Richland is bringing to our community. So welcome, Tasha. I'm so excited to talk to you. We've had so much fun off camera already. I cannot wait for the audience to meet you and to hear about all of these things that you are over. So I would love for you to introduce yourself to the audience.
Sure.
But also maybe your title and some of the nuance there.
Sure. So Dr. Tasha Jones, Dean of Allied Health Professions and Nursing, 2 different departments.
Okay.
So Allied Health includes EMT, which is our emergency medical technician, health information technology, surgical technology, radiography. We have a phlebotomy certificate. We also have a forensic phlebotomy certificate for police officers that are working out in the field. And I am missing one more, medical assisting, which has phlebotomy, health and nutrition is under there. We also do CPR programs underneath the Allied Health umbrella.
Okay.
And then there's the nursing, which is all things nursing. So that would be our certified nursing assistant, our CNA program, our practical nursing program for students that want to become LPNs. And then we have ADN, which is our RN program.
Okay. So. You guys have quite the variety of options out there. And I loved how before we were talking, you were really breaking that down, some of the nuance within the education of it.
Yes. Each of those houses, they all have different requirements. So we look at the industry standards. What does the industry need in the community for healthcare workers? Then there's the accrediting body side, because every department like surgical technology, radiography, the nursing programs, they all have different accrediting bodies that require different strategies for the students, things that they want them to know to pass their certification exams. And then Richland overall has a strategic plan. So we look at that. Strategically, what does the college want to do? Dr. Zuniga, we call him Dr. Z, who's our executive vice president. He has a plan. President Valdez has an overall plan. So just aligning all of those pieces to make sure that we are meeting all of the metrics while at the same time helping students reach whatever their professional goals may be.
Right. And with Richland being a community college, I'm sure that there's even a strategic plan around what our community needs.
Absolutely.
Are there partnerships within the community that you kind of work with, bounce ideas off of, figure out kind of the connection points for those?
Yes. So each of our programs, the accrediting bodies require.
The accrediting bodies.
Yes.
Seems like this elusive, ethereal thing out there, man.
They come and see us every 4 or 5 years or so. They require that we have advisory boards.
Okay.
And so every program has an advisory committee. They usually meet twice a year. We come in, we talk through, these are our graduates. These were our pass rates. These are where the graduates have gone to work. Most of them stay within the community, which is always a plus. And then we talk through what are the industry needs? What are some things that you are seeing from our graduates that are good? What are some things that you're seeing that are not so great that we need to improve on? Because we also take the students who haven't graduated yet, pre-service students, they do clinical opportunities also. So they're at DMH, St. Mary's. We take some of them out of the community. Some go to Springfield, some go to Bloomington, to OSF. So they get, just a plethora of experiences. We want to make sure that they have all of the experiences that they need to be able to function very well when they graduate from us, and not specifically tailored to one place.
Right.
We want them to just understand overall, if you're going for a nurse or surgical technologist or radiography, these are the requirements no matter what environment you find yourself working in.
Right. I completely understand why there would need to be not just a baseline, but a plethora of understanding, education, knowledge, so then you are transferable, because a lot of these fields are kind of standalone, but they all overlap.
Yes.
Right?
Yes. Yes. And usually, as I was saying before, when I recruit, I talk, to students a lot about how our body works. The circulatory system has its own function, the nervous system has its own function, but together they ensure that our bodies do what they're supposed to do. And so it's the same within our healthcare field. Nursing has their own requirements, surgical technology, radiography, HIT, they all have their own requirements, but together they make up our healthcare system. And so we all work together, even though we all have different, requirements, different ways to do the end goal is when you come in, you get the service you need, and we send you out, and hopefully we will just see you, for a maintenance visit and not have to come back for something more serious.
Right. Gotcha. A lot of times whenever I hear the term healthcare, I typically think nursing.
Yes.
Right. Which I'm sure most people do.
They do.
But, even from hearing you speak, I like the forensic side, the EMT side, the radiography side of things. So, I'd love for you to kind of speak towards maybe the variety of options that are out there. Because, I could have a heart to want to help people and might be interested in nursing. But however, not really know some of the things medically that might be available out there.
Yes. So like, for example, let's say someone gets into trouble at home and, it's a dire emergency and you cannot physically get them into the vehicle to get them to the hospital. Well, you need an ambulance to come. You have EMTs on there. EMTs, you have paramedics. They see them on the front line and they make sure that they stabilize them. They call the hospital ahead. We have X, Y, and Z going on. We're going to be coming in. They come in when they get to the emergency room. The nurses are taking them off. They're doing, all of the diagnostics that need to be done. You might have an LPN that's working there, taking a pulse, or if they have to have surgery, then you have the surgical technologists that are scrubbing in because they're getting ready to help the surgeons, to do a procedure. If it's a non-medical emergency, because sometimes we go to the emergency room because all of the other offices are closed, right? And then you go into registration, there may be somebody from Health Information Technology that's taking, they're putting you in, want to know what your insurance is, and they're putting in the right codes so that your insurance is billed correctly, because we don't want those high insurance bills for incorrect medical codes. So they all work together. Radiography, I know there was one time personally where I had to go to the doctor. They didn't know what was happening. And so my heart rate was out of control. They told me to go to the emergency room. I didn't want to go because I knew they were going to stick me because I don't want to be stuck. Those darn needles. And so, but when I got there, they wanted to do an x-ray. And so they sent somebody in from radiography that came in and they wheeled me out and they turned me a certain way. All of that, all of those things all work together. And unfortunately, when I was in school, all I heard about was nursing. So we try to, for us at Richland, we try to make sure that students are aware there are a number of healthcare professions that you can participate in, bring home a more than livable wage to take care of your family, but also to be able to help and to serve the community.
I love that because I think sometimes it's the first step of interest.
Yes.
And then once you walk through the door, and really in any industry, any career path, it's not always first step, I want to be this, so I become this. But you're like, if you're interested, we've got a lot of options out here. Let us help you walk through that.
Yes.
So let's say I walk into Richland. I am interested in the medical field, but not quite sure what area might be best for me and my interest and my skill set. Is there like a baseline of medical and then you walk people through some of the maybe interests or different areas? Or do you try to talk them through that so then you know what program to put them through? We
do try to talk them through them. So like, for example, surgical technology, radiography, LPN Bridge, ADN, they have selective admission, but there are some prerequisites that students can do, and most of those programs have introductory courses that any student that's interested in could take it. So like CNA is a certificate. It's 1 semester. If you are interested in being an LPN or an RN, you have to be CNA certified. So that's a course that a student could take and decide, oh, I don't know.
Right.
If I want to do this. Surgical technology, Surg Tech 110 is their introductory course. Brooke Oliver, who's the program director, does that.
Okay.
That's a course that students could take that are interested in surgical technology. And it also gives you an opportunity to figure out, am I up for, being, in an operating room where it could be a gunshot victim.
Yeah.
I could have to do a knee replacement, and the different tools and things that they use. So students have let me go back. It's a part of the curriculum pathway, but it is an opportunity for students to kind of feel it out. Same thing with RADT 101.
Okay.
It's a requirement in order to apply during the selective admission window, but it's another course where if somebody was interested, you could kind of feel it out and see. Because
I feel like
not.
pinning down where I would operate best would be a process. Because if you don't like needles, you might not want to be in that
Lobotomy
role.
will not be the one.
But you're okay
Love y'all.
with dealing with x-rays, right?
Right.
So trying to navigate and maybe pinpoint some of those along the way would be important.
Absolutely. If you're going to be a nurse, which is why I didn't go into nursing, at some point, you're going to have to stick somebody.
Yeah.
There may be another health information technology, there's no sticking,
see?
But there's codes, you still have to know how the body works,
right?
And so I think sometimes when folks hear about health information technology or EMT, they think, oh, well, it doesn't really have anything to do with the actual body. You still need to know where the heart is located. You need to know how many lungs someone had. All of those things are still important.
Sure. And I'd imagine even on the EMT side or the paramedic and the things, you're dealing with crisis.
Yes.
So
you're meeting somebody on their worst day.
First responder to crisis.
Absolutely.
So there's even a different angle of mental space, clarity, being able to be reactive. That would be needed within that too.
Absolutely. I don't know, at one point, I know that we're working very hard to help with EMTs, but oftentimes, depending on where you live, people are waiting for ambulances to respond, not because there's not enough ambulances to do that. It's just the fact that there are not enough EMTs. And so there is just a healthcare shortage. And when I call 911, as a resident, my expectation is that the fire department, the police, or the ambulance is coming to my house.
And they know what they're doing, and
when
they're
they
quick,
get there,
and they're efficient, and they,
to either retrieve me because I'm in distress or a loved one, and then they're going to take them to the next step. And when they get there, they're going to receive the care that they need. That's the expectation.
Absolutely.
And so when students come into our program, we really hone in that ethical, that critical thinking, the professionalism, because sometimes, depending on where you're working, you are meeting people on their worst day. And for some, it could be their last day. And so we want to do all that we can to prepare our students for whatever environment they're going to find themselves in.
Within your program, leaning into that idea, because, you can have the training, you can have the accreditation, the certificates and all. Is there something within Richland's approach that really comes alongside that human-human connection? And how do you walk your students through that?
Well, each of our accrediting bodies, they all have a piece that requires that trauma-informed training, with each of the programs, because we know students are going to face that when they get out. We know that a lot of people are leaving the health professions, also some, due to retirement, others because the environment is very stressful.
Yeah.
Our partnership also within our department is with Enrich Healthcare, and they do essential skills.
Okay.
And so with the essential skills program, it's pretty much the same thing, having that professionalism, but also giving them the trauma-informed practices that they're going to need, because they are going to be facing some really stressful things. So each of the nursing programs, HIT, surgical technology, radiography, they all walk through, just the mental health capacity, things to do, when you have long days, because they don't,
right.
We work 8 to 5, they may work 10 to 10,
right.
No holidays off, just depends, if somebody doesn't come in. And I learned that from my mom, that oftentimes with nurses, it's 5 o'clock and my shift is over. It's 5 o'clock. I need to make sure that my patients are good, and then I need to hand them off
right.
to the next person. And so that could just extend the days. And so we try to build some of that into also the clinical aspect as well, just to let them know, this is the profession,
Yeah.
this is what's required, but you also have to make time to take care of you.
Right. I'm curious, because we've had a variety of people on the show talking about essential skills, and I love it. I think everybody needs essential skills. I think it's just a beautiful, holistic program that really creates healthy human beings.
It does.
That help connection with people in any of those things. And I know a lot of it is, from what I've heard at least, is a lot of self-trauma informed, being aware of me, my triggers, self-management, etc. I would be curious of your thoughts around the importance within the healthcare to have the outward trauma informed of whenever you're dealing with people in trauma.
Yes. And so we talk a lot about that too.
Okay.
And I think that that's just an overall skill that just as people,
right.
We need to have, because you never know what has transpired in someone's day. You don't often know when they respond in a manner that might be curt to you.
Right.
If that's just their way of communicating with you. And so we talk a lot about having unbiased approaches and not taking it personal, although
right.
it feels personal. When students come in to talk to me because they didn't receive a grade that they thought that they should have, or they feel like they're not being heard, they're very animated when they have conversations.
Sure.
But it's not because they're angry with the dean, so to speak. They're just expressing how they feel. And so having an awareness of what your triggers are and the things that impact you, I believe gives folks an opportunity to be able to understand when situations occur. Is this really a situation occurring, or is this a trigger for me because of something that may have happened in the past? If a gentleman is talking to me and he's got a lot of, bass in his voice, you gonna do this right now kind of a thing, is it because I feel like my dad is like, if you don't do this right now,
right.
Or is it, he's just expressing how they feel. And so all of those codes are kind of written in our handbooks of, it's an unbiased approach. We all don't politically see eye to eye. We don't religiously see eye to eye. Allow people to be who they are, take them as you find them, and still offer that support while still being affirming.
Right.
And, if you have to journal or, call your husband, like, you know what he said, kind of a thing, then do that. But that should not impact the care that, people receive. And historically, it has impacted people's care.
Right.
And so we are working very hard to make sure that our students understand, no matter how people respond to you, you have an ethical commitment to ensure that you are responding and providing the actual care that people need, regardless as to how they may respond.
Right.
Respond to you. And I know that a lot of our clinical partners like DMH and St. Mary's, they also offer some of that same training because you know how it is, when you're rolling grandma into the emergency room, mom and dad are very upset. And so sometimes the environment can be hostile, but it's not because the individuals themselves are hostile. It's just
they're
a
scared.
crisis. And
they're nervous.
Yeah, it's a crisis situation.
Yes, they're getting triggered.
Yes.
Being able to, I think, also, when you have the tools to kind of understand yourself,
yes,
you have the tools universally to, I think, extend grace and see others
absolutely,
of understanding.
Absolutely.
This is a crisis for them, even though it's not for me. And they could be feeling triggered. They could be feeling scared. They could be having memories flooding their mind. They could be feeling lonely, all the different
things. I've been here 3 times and it feels like no one is helping. Well, I'm here to help you. And let's see what we can do to ensure that you get what you need.
Oh, absolutely. You know, I didn't prep this, but as this is coming, I have a question for you. You know, whenever we hear some conversations, specifically around AI, or whenever it comes to some of the automated things within our lives.
Yes.
I would love to hear your take on why there is such an importance, specifically within healthcare, where that human component is important.
It is. And I think the best example is, you know, when there's something wrong with your phone, I don't know about you, but whenever I call, I get very upset when I have to keep pressing 0 and I keep saying, operator, operator. Why? Because I need a person to be able to say, you know, I'm having this trouble. This is what's happening. These are the things that are going on. I need you to help me, you know, and I think the inflection in my voice, if it's a Zoom call, the way that my facial expressions are, kind of helps the person on the other line to be able to kind of differentiate it. Okay, like, oh, okay, she's making this face, you know, it must be something else, right? Yeah. Instead of the computer saying, unplug your phone for 3 minutes. You know, it's like, I've already done that, you know.
I'm getting triggered.
You know, I've done that already. And it's the same, you know, in healthcare. When you have that face-to-face interaction, the nurse or the surgical technologist or whoever can see your facial expressions. They hear the passion in your voice. You're pointing to what's happening. They can actually press it and go, oh, okay, so that's causing pain. All of those things, all of those anecdotal notes that they would pass on, you know, to the doctor are very important versus a computer they just, you know, they can't do that. Now they can troubleshoot some of the basic stuff, you know, but you know, for a new mom that's taking a colicky baby, you know, to the hospital, it's more reaffirming when there's a person to say, you know, colic is not a new thing.
Right.
Here's some tips and some things that you can do to help your baby, you know, or I know that your son's arm is broken and that's a scary thing. Here are some things that you can do, you know, whereas the computer can just say, you know, put a cold compress, call your doctor in 24 hours, you know. Then, thank you. And then, you know, just hang up. But we want that interaction. And I just think that we're, just as human beings, are designed for that face-to-face interaction, you know, a smile or something to reassure somebody, to say, especially when it's around our healthcare, that you're not insane. Oh, yeah. The pain that you're feeling is real. And I am here to be able to help you.
Right. I know, you know, personally, I've had some health issues that wasn't a straight diagnosis.
No.
And it can be very scary, and it can be very, I'm not crazy. I don't know why. This is what I'm telling you. And I think, you know, you really hit the nail on the head whenever it comes to that human element of somebody sitting in front of me, seeing me, believing me, comforting me in this moment in order to help these things and to continue to troubleshoot with me.
Yes, until we get to the point.
Until we get to that point.
Yes.
You know, whenever it comes to health care, if we're trying to create health, I think relationship and connection is a part of building health.
Well, and that other part of health is care.
Right. Right.
I want you to care. You know, if I'm crying and saying my stomach hurts, I have done ginger ale and I have done crackers. You know, I've done the salt water. It's not working. You want a healthcare professional to be able to say, let me let the doctor know. Let me put this in your notes so that we can figure out, you know, what is happening. And then, you know, the community also having grace with the healthcare professionals too, right? Because, you know, we don't always have all of the answers, but because we are practitioners and servants at heart. We will do what's necessary to get those answers.
Right. And I think even if you take the root of that word of a practitioner, we are practicing.
Yes.
Because
it's an everyday thing.
Let's get real. The nuance and complexity of every human body is so different too.
Yes, because we're all different people.
And we're like all little petri dishes.
We are.
And each of them are so different.
Mm-hmm.
So
with
like
different organisms.
What my body might need or respond to or be more receptive to or need more support with or be sensitive, et cetera,
yes.
is very different from you.
It's very different.
And so, as doctors in the medical field, I think, there's something absolutely to be said for like training and knowledge and professionalism and getting as much as you can in order to help me as much as you can.
Absolutely.
But there is a practice element to it.
Yes.
Right.
Yes. They're not, when our students graduate, they are still, novices, learning, as they go. And I mean, we have faculty who have been nurses for 20, 30 years, and they still learn something new. They still do their CEU. So most of the programs, the accrediting bodies require,
They require a lot.
I love these accredited bodies. We love them. Continuing education. So we start that early with our students. We take them to different conferences and, we bring folks in to have conversations, about, what hemocrat is and how to read, urinalysis. So we do all of those things because we're trying to tell them this is an ongoing, ongoing thing. Just because you receive your ADN or you become a surgical technologist, that does not end your journey, and I think that is also one of Richland's overall mission, vision, goal, strategic plan, what have you, is that we want to produce lifelong learners because learning does not stop just because you're leaving the community college and maybe transferring on or going right to the workforce. There's still a learning component, and we want to ensure that our students understand things change. Things that we knew pre-COVID are very different than what we know post-COVID. And I'm sure that there'll be another pandemic, prayerfully not, but there might be. And so we want students to know these are some of the things that you need to do. You need to stay on top of the field. What's happening currently? What's evidence-based practices that are occurring, for ADNs or for EMT? What's happening within the state? What's going on within our communities? All of those things is still research-based. It's still learning. So the learning doesn't stop because we pin you in May. It will continue on as you move into your career.
Right. And as time, science, culture needs evolve, we need to be able to evolve with it in that component.
Absolutely. Absolutely.
Within, our fields of expertise of what we're bringing to the table. But that evolution component and that need to continue to innovate, which is what Richland is doing.
Absolutely. It was one of my nursing faculty that was saying, a lot of, a lot of things that we do now, that they used to do in the doctor's offices, people can now do at home. For example, checking blood. Now, if you have to check, a spouse's blood, they walk you through on how to do that.
Yeah.
Or, how to check the catheter to make sure that it's doing what it's supposed to do. So we're expanding. And so it just depends on what the next 5 years is going to look like, what the medical advice is going to be. And nurses are now not only having to help not just students, but help folks that are coming to the hospital or the clinic setting, but you're also having to train family members on, now when you get home, these are some things that you need to do. And so I think, just going back to that component of understanding how people operate, being able to still provide that service, all of those things are important with that essential skills, that trauma-informed practice of making sure, that family members have what they need. If you see this, if they act this way, we need you to call 911 because we need them to come back.
Right. you're marrying the human component
Absolutely.
with the practical,
Absolutely.
which is the heart of what essential skills is.
Absolutely.
But I think whenever you blend essential skills into a program with the accredited bodies, it's nice that you're blending that human component in with professionalism, excellence, medical terms, tactical skills, etc.
Yes. And just being resilient. Rebecca Zuniga talks about that a lot, about the resilience, because people are resilient, but healthcare workers have to be resilient too, because you're just hit with so much stuff, and so just having that resiliency of, yes, today is hard, but you can do it, and our students, many of them are working adults. They have families. They have their own stuff that happens in their homes. And so just building in that you can do this, you are resilient, you can do it. Those skills also transfer over when they go into, the healthcare profession. You kind of build calluses, if you will, and so when situations occur, initially it's like, oh, this is so hard. But then once you've done it, it's like having the first kid. Oh my gosh, I got to be up all hours of the night. They're eating all the time. It's just, but then when the second one
wake up call, ain't
I
it?
know it is. But then when the second one comes around, it's like riding a bike. Oh yeah, it'll be fine. Yeah, we've potty trained before. And there's always something different. Somebody doesn't actually go to the bathroom; they go other places, and it's like, oh, that's new. But then the third one, like, okay, so we know they might go other places, they might go here, and it's the same with our students, right? You get through that one course. Oh, this is overwhelming. But by the time you get to the second and the third, you have an idea of this is what it is. I have the skills, I have the processes in place to make sure that I'm successful. And we try to train them. When you get into the field, it's going to be the same way. Initially, it's going to feel overwhelming. But with the support of, your new employer, we are still available to support students. They come back and talk to us all the time. The instructors, when they're at the clinical sites, they see them. You still have that support, by your second, third, fourth year, you kind of get into a routine of, I have an understanding of, what's going to happen. There are always surprises, but it doesn't feel as hard, especially when you feel that the village is behind you.
Yeah, and Richland is definitely a village. I feel like anybody who has sat in my green chair has definitely related that Richland is a village.
We are a village.
That supports from the time you walk through the door, even into career paths of continued for success.
Yes.
And I think that's a beautiful thing, that it isn't transactional as much as it's, this is like a process for a better life, and we want to be able to be a part of that throughout the whole thing.
Yes, and we also survey a lot of our graduates too, because we want to know also, what was your experience? What were some things that you liked? What were some things that you didn't like? Did you feel prepared once you passed your certification exam and stepped into your role? Our accrediting bodies, they love to see that too. And so does President Valdez and Dr. Z. They also want to know, how things are going. Are there additional things that may be needed? Our board of trustees are very supportive, because they're the same. We want students to get to where they want to go. And if that is into the workforce, then let's get behind you and do what we can to make sure you get there. If that's off to a four-year university because you're wanting to go on, let's make sure that our articulation agreements are in place, and that, we bring colleges in. So that village, we're all interconnected. I may be health professions in the Schroep building, but I'm also connected to student success, financial aid, Meredith Johnson Palmer and her team. I'm connected to her. I'm also connected to the culinary. We're all connected together, and our one goal in general is to make sure we educate students, educate them well, get them to where they need to go. As President Valdez said, we often have differing ways to get there, but our heart and our goal is the same.
I love that. Well, as we wrap up here, I like to always leave the listeners with a connection point.
Okay.
So if they are interested themselves or know somebody that this might be a good fit for, what would some next steps be for someone who is showing interest in the medical?
Next steps first would be enroll in Richland Community College. We're waiting for you. So that would be the next step, to enroll in Richland Community College. They can always call the Health Professions Office. We're always available, to answer any questions. We also partner with Millikan University. We do what's called Healthcare Days. We will be at Millikan this year on their campus. We have a number of programs. Enrich Healthcare brings in students to come in as well. Anybody can come in anytime and get a tour. Nick Harper is our CTE individual in our Student Success Office. He also does tours. You can come in and tour our simulation labs. Our program directors are always on campus. And if anybody is interested, just walk through the door. We'll get you where you need to go.
Well, thank you so much. This has been a delight. I love sitting and just learning more. I appreciate it.
Thank you. Thanks for having me.
Yeah.
Bye, everybody.
Bye.